Good morning, everyone. It is, goodness, 9:13. I will now call the meeting to order. Stephanie, please take roll call.
Sure. We did one sheet,
Here.
Constance Alphonse. If she's on, she was having issues, but she said she's on this tier, so I'm gonna skip her for now. Jill Hano.
Here.
Jill. Lamar Meadow,
Here.
Eric Taylor,
Here.
Aaron Shield. Yeah. Maybe you have 5 able tomorrow. Oh, excuse me, this Constance just got here, perfect. Hey. Yeah, perfect timing.
Okay,
Yeah, you're-
sorry. Thank you, Stephanie. Before we start, here are the raise your hand if you want to speak. Wait until I call on you before talking. Keep side conversations quiet. Stay on the topic we're discussing. For people joining by Zoom, you must be on camera with your full name showing to count for a quorum. Keep your microphone off unless I call on you. Click raise hand if you want to speak. Wait until I call on you before unmuting. For all attendees, the Q&A box is only for people who asked for an ADA accommodation. It is not for public comment. Committee members, in person or virtual, speak first. Then in-person public members, then public members on Zoom. Please be patient. Hybrid meetings can be hard to manage. If we run short on time, comments may be limited. Comments about a person's character are not allowed. Public members will have one chance to comment on each agenda. Each person has 2 minutes. Public comment will also happen before a vote or at other times if I allow it. Let's work together to keep the meeting respectful and on track. Everyone should have reviewed the concept papers which were linked in the agenda you received by email. The concept papers were submitted during the 5-year planning process. For the council to consider, staff included notes on where each concept could fit in the council's plan and provided additional information. Are there any questions about the concept papers?
I'm sharing the concept papers right now. On the screen. This is just kind of like the table of contents. I also included in all of the packets, the actual concept papers. Those are the ones that were under the 5-year, when we did the 5-year concepts that were submitted. So I made just like a little chart for y'all, but it's kind of in the second stack of paper clipped items. So everybody should have that. Those are the actual papers that were submitted, and then this page was just the like a table of contents overview of them.
Good.
And Jill has already stated.
Yes, Jill.
I think you just answered my questions, Stephanie. But these are the 5-year, these are the same content papers that we got in the 5-year planning committee packet, like a while back, right?
Yes, that's correct.
Okay, thank you so much.
No problem. Aiden.
Sorry.
Have your hand raised.
Yes, ma'am.
Yes, I was just curious, the expanding paraprofessional education, why is that one outside of the scope of the council?
When staff talked about it, that was. When we spoke about it, just from reading what was on. In here, it was more of changing, like policy, and we felt that that was more for individual school districts. If I remember our conversation correctly.
With the Constance, I think what, I guess our train of thought was that the Louisiana Department of Education is very specific about what trainings they give their teachers, paraprofessionals, and they've been, I guess, it's been communicated to us that they make trainings available to the paras and to the teachers. And they have to go on their own to take those trainings. And so, we've just been informed that they make trainings available and that the teachers are able to go and take those trainings when they have time. And so I think we were thinking it's outside of the scope of the council to try and train paraprofessionals or even teachers outside of LDOE. We would have to get them involved, and I guess it's been our experience that we just haven't been able to work with them on getting peers and teachers trained in this type of way.
I would say they just started some online system where they do trainings, that's online. They have the teacher leaders, that would be like an avenue or something like that could be developed, like that's not necessarily. As parents aren't typically the audience that is. Let's say that. I would say that's not a resource, and they generally contract out with people to do it. They're not their staff. It is like the concept paper. It is a group. Like it's a. I think that's something we can take to education for discussion with LPO.
Okay.
I'm making a note of that right now, and I'll make sure to, just contact the LDOE representative to just let her know that we wanted some more information on, maybe just like what their training includes or any like yearly like CEUs or whatever they need. And then that way we can kind of have those conversations during that meeting. I agree. And if there's anything specific, just send me.
Mr. Taylor,
What's, with the training, what specifically they, training them?
Are we talking about the paraprofessionals at school?
Yeah.
I'm not sure what specific training they receive, and I think that's what Constance was asking, to kind of talk to the Department of Ed representative that we have on the council and have her talk about it at the Education and Employment Committee, so we can get a better idea of what is, what that training looks like for the paraprofessionals. To kind of see if maybe there is something within the scope of the council that we can do. It just may not be this year.
Yeah, because I feel like as a woman, they could say they doing training and this, we should always training, but you really need to know what's the specific stuff that they.
I have a feeling they're gonna say that that's district specific, if I had to guess. So it depends on the school, it depends on the district. I think that they're gonna say that, and that's just my assumption. I may be wrong. I'm sure that there's some kind of, everybody has to do this. But how they do it, or what other optional or extra ones certain people have to do, I'm not sure if they'll have that information. So I'd like to maybe talk to the LDOE representative so she can give us a better understanding of that. I know that's not the answer you wanted, Eric, I'm sorry.
No, but because then I just don't want them to just use it, hey, got the training and not really have the true training.
Right.
Right.
Dr. Meta,
I think they are very, very important. This paraprofessional in the classroom, to re-emphasize or help, students in the classroom that are lagging behind, right? Just a couple of things. So the school district having a hard time, keeping these professionals, right? Can this be constructed in such a way it doesn't matter if it is me or you that's there, and we just jump into the job? Because, again, I guess it go back to training, right? So if we have the same training and we do exactly the same thing, it doesn't matter if it is me that is there or you, or Ebony, right? Because we can continue doing the exact same thing from where the other person is left. But I'm trying to say it doesn't matter who is in there, right? Because the job will be such, such a way that, the person that is in the classroom doesn't matter, right? It's just following, the ABCD, to have the students in the classroom. The other thing, what about this, the cost? Do we have an estimated cost on if we were to do this, what it will cost us?
For the paraprofessional.
Yeah.
So in the paper, the estimated cost just says salaries for training and costs for travel and materials.
Yeah.
So we don't have an actual number.
Okay.
I will say if we look at the committee recommendation paper up here at the top, there is a range in training, and this is from our last 5-year plan. All of our training activities range from 35,000 to 80,000 for each activity. So that's just kind of, I know that's a large range,
Yeah.
but that was over the 5 years, so I would say it would probably fall somewhere within there.
Yeah, can I follow?
Yes, sir.
I think we said, we're gonna follow with the LDOE about more information. I think I didn't quite get what kind of information more information we're gonna get from them.
Sure, I wanna find out what overall training is like required from LDOE for paraprofessionals.
Okay,
Hopefully they can give me that information. I don't know. I don't know if they will be able to, but that is my hope, at least
find out what they do.
Yes,
You know,
exactly, what they're required.
Look at what they require, okay.
And what kind of like ongoing training, so not just onboarding, but like what kind of ongoing training every year are required for paraprofessionals. And then even if they have like maybe optional training, because I know depending, I don't know, but I would hope that depending on placement of the paraprofessional, if they're in, a self-contained class versus like the general population class where they're just popping in, maybe that training looks a little bit different depending on the person. So just kind of getting more information on what kind of training is required, I think that would help
Okay.
guide what the council would like to do.
The next document is recommendations from the council and public comments from the 5-year plan. The document was also linked in the agenda and sent by email. Everyone should have reviewed it.
So Chair, Jill has her hand raised.
Yes, ma'am, Jill.
Do y'all have a quorum without me? Cause I need to go move a table to be closer to my charger.
Yes, we'll have
Yes.
yes.
Okay, cool. Thank y'all.
So I just wanted to explain this document really quick. At first, the first section, I just put the note up here, the range with the cost of training, like I said earlier. For any activities is 35,000 to 80,000, and that was for the last 5-year plan, so 2022 to 2026. The first little section of this is committee recommendations from the 5-year plan. So some of the recommendations were activity recommendations. So I did keep all of that and I included it here with where they could fall under that possible objective, and then some notes. On the second page are the committee recommendations from the January council meeting. And it has the same information, and then I don't know, fourth page maybe, is the 5-year plan public comment recommendations or suggestions. We had a lot of comments for our 5-year plan, and they gave some activity suggestions or recommendations for the council. So I wanted to include that also. And it has the same kind of outline with the objective and the notes. So I'll go ahead and look that over, but if you have any questions, please let me know.
Yes, sir, Mr. Taylor.
I had a question, I'm just go back on the training, for a minute. Is we just training teachers or is we overall training the age too?
The concept paper was specifically for the aides for the paraprofessionals.
Yes, ma'am, Ms. Constance.
So the one on the back of the first page, the transition, very last one in the K-12 space. So it says the note is better as advocacy and further guidance needed. I kind of brought that one up at the last council meeting. I think with that, what I was thinking was specifically based on what I see in my work. Transition planning is not really happening the way it should be happening. It's more of a checkbox. It's starting too late, even though it's supposed to start at 16, might, but it's not effective. And so we're not effectively preparing our students to enter into the workforce or enter into whatever it is they want to do next. So really starting to train at that middle school level of what does effective transition look like? What should we be doing in these meetings? Who do we need to have at the table? What does person-centered planning look like for these individuals? What is our role as educators and as community members? How do we support how do we support these students? And not waiting until they're in 12th grade and then, oh, what are they doing next? That plan needs to have been developed down there in 7th or 8th grade, starting those conversations with that parent. And then they can go in the direction that's helpful. And I don't see it necessarily as an advocacy issue in that we have things that say we're supposed to be doing things. We're just not doing them. And I don't think it's teachers are overworked, and then it's also that just they don't know. Like, I think you might take one course in college on transition planning. And so they really don't know what to do when you show up in the classroom, especially with the group of teachers we have that are not even SPED trained. They're just showing up, and they might have been a car salesman the day before, a nurse the day before. So I think it's more that giving them the tools and showing them what they need to do, explaining what that process is.
Okay, can I ask a question?
Go ahead.
Oh, I'm sorry.
No, go ahead.
Anybody on there? Did you have a question, Nicole?
I just wanted to talk about one of the things, but I can, whenever it's
okay.
appropriate.
I just wanted to add, so I think that's why one of the notes is further guidance needed. So I know you just said giving them the tools and showing them what the process is. I guess who is them, and like, how would the council, because this is what you guys are here for, how would the council put this into an activity in order to get it accomplished? And so that's why we're like, we need a little bit more guidance on what the council can actually do, because anything that they do, it has to be either capacity building, it has to be systems change or advocacy, which is why we were saying it may be better as advocacy, because you just brought up, it's already in writing that they should be doing it. I guess, can you give us a little further guidance on what you think the council can do or put into an activity in order that has to be either capacity building or systems change or advocacy, where we can like reach this goal?
So I think it's a training of some sort. I know this. One of the concept papers ties to this.
Did he stay in the paraprofessional education?
No, not that one, it's one specific.
Oh, transition plan, was it transition?
It's
plan?
the transition planning one. So yes, it's the second one in the packet. That particular one there kind of talks about all full disclosure. This was an HGC concept paper. Full disclosure there, but it does talk about kind of like a training plan to be able to support families and educators with understanding a range of services that all connect back to transition.
Would this fall under system change? Because, that means we need to know, what effective transition look like. So because we already have it, right? So it's just not being effective, right? That's what it is.
We will fall more under capacity building.
Yes, you have like we have rules. There
Yeah.
are things that tell
Yeah.
educators what they're
Yeah.
supposed to be doing. But it's the way it's done is not in a way that's helpful,
That's helpful.
effective.
So it's,
That's not the first time.
Oh, okay. I'm so used to, I just don't wanna speak out, I just don't wanna speak out, I just don't wanna speak out of turn.
You're doing better than the rest of us.
I'm trying, okay? I'm trying. I do have a
Drink some
question.
water.
I do have a question. Why? And you may have answered this already and my brain is just going on into nothing. Why do we feel like it's not getting, the training's not getting done? Or things are not going the way that they're supposed to go?
I, based on just observation and opinion, like I have no data to support this, it's just my work in the field, is that teachers, they just don't know, no one's told them. And so you hear, oh, they turned 16, and you happen to be that 8th grade teacher. Oh, let me make sure, okay, I need to send a letter to LRS, and it's like a checkbox, but
Right.
no one understands really what does this mean? They don't understand. And this is, I would say in education in general, that transition from what happens at a lower grade and how what you're doing when that child is in 6th grade, 7th grade, 8th grade, how it impacts in high school. And so what happens, I feel like, is that children just get pushed through and then magically they're about to graduate. And then it's like, oh, what are we supposed to do? But if we would have done steps in 7th grade and 8th grade and said, okay, this is the path that this child is gonna be on. These are the things we need to do when we talk to the family and we talk to the student and see what those needs are and where they wanna go. We develop a roadmap to get there, and it's a roadmap that's not being developed. It's just happenstance, check boxes.
So it's there, so it's it's me that is not doing my job, right? Is that what we're saying? Because I mean, it's just
I don't want,
oops, 16, 17-year-old, well, let's go and do the checkbox. I didn't do A, B, C, D, from when they were, 15, just getting to high school, and 16, 17, and all of a sudden, right?
and
They're
so,
not,
yeah,
I
I
mean-
wouldn't blame like the teachers. I would say it's more that's why like Ebony's saying capacity building.
Yeah,
It's more they just don't, they don't know. I don't think anybody's intentionally making it a checkbox. That's how they've been trained. That's how it's just gone, oh, well, they're about to turn 16, we need to do a transition plan. Okay, what are we gonna put in this transition
Yeah.
plan? Oh, they're gonna
Yeah.
pass a class, or they're gonna
yeah.
take it generic.
But the thing is, whose job was it? To make sure when they were 15, 16, we were checking, okay, well, Lamar now can read, okay, now, 17, Lamar can write. And so now I'm about to graduate, so everything is done. So I think it's maybe responsibility, right? I mean, whose job is it to make sure that I was doing my job?
You don't want me to answer that.
No, I'm just saying, so, anyway, so it seems like if it is already there, someone is not doing their job. That's all I can say. Someone is not doing their job to make sure I'm doing my job in the classroom, or the paraprofessional is doing his or her job. Because the students are there, they come in. Someone, and the rules are there, whatever they're supposed to follow. And someone is just not connecting the dots.
That was my question as well. Who is responsible for making sure this is all connected?
I don't know if, I honestly don't know if districts appoint a transition coordinator in districts. The state gets the IEPs where these documents are supposed to be developed. But I'm not sure if there's a uniform method of law for who's verifying information. Doesn't mean there's not one, it just means
Correct.
I don't know about it.
Correct. Yes, sir, Mr. Taylor.
This is my thing. My thing is with, and I'll piggyback off of her and she's saying, if I'm saying the wrong thing, Chip. She wants, what she's acting, and this is what I'm asking is, we want to make sure the kids is prepared for whatever they need once they get to the levels that they need to be at. So when they get to 18, 21 or whatever age they at, they is prepared for it at a lower grade level, and then saying, okay, we're gonna put them at this high grade level. And then when we get ready to leave them out the door, okay, we don't have the time to get them ready because they're already at that level. And it should be started at the bottom first and then work it way up. So when they get to the part where they on their way, they're already set for society, they set for a job, they set for everything that they need. And not just lingering in the system saying, okay, let's check this box. And okay, they're not ready for a job. They're not ready for independent living, and it should be done at the bottom first.
Yes, ma'am.
I just have a question for the status of the quality. So where
The status report. It's in your packet.
It's just a status report. Oh, so I put in, like, last one we talked about, the concept about being diagnosed as treatment team. It said cannot afford all the loans, but their books already have 3 years. Student, activity 2.31 on status report. I tried to find from this, but I didn't. I need more to talk about.
Oh, I'm sorry. I put the wrong number. I'm so sorry. It's 2.13. I'm sorry, I had the numbers mixed up. And I will talk about that one for a moment. So this specific concept paper is the part that the council cannot afford. If you look at the amount that they said the cost estimate was, it's over $1 million. Which we don't even get that amount for the activities, so we cannot afford that. But we did a similar training, the council worked on the dual diagnosis for 3 years, and that is activity 2.1.3. So I'm sorry, I had the wrong number, 2.1.3. And if you look at that, it gives the information over on the past 3 years and just some background information on the activity. Sorry.
What page is that on?
It's on so,
That is. This one?
yes, okay,
Okay.
it's on page 6, yes, sorry, I'm getting all confused.
All right.
It talked about very low in the participation. Why it costs so much? I just a little bit curious.
I'm sorry, can you repeat the question?
The status report talked about the participation was very low in each region. Full meetings had to be rescheduled, no registration. And no one saw up at schedule, so whether it had cost over 1 million, I'm just curious why that cost that much.
No, so what we did, the activity that the council did cost $30,000.
Such as well. So this money, where the funding from, is 1 million? Because.
The 1 million is coming from the concept paper, and that was outside organization that sits in their concept. That said that if they were to complete this, it would cost $1 million. So we, as the council staff said, well, we can't afford $1 million. We did a similar activity and we spent $30,000.
I was thinking, oh, I was similar activities. So this one. Oh, I didn't see the concept report, you have that one?
The actual concept paper, it's in your packet. It's from Nearkey.
Why I talk about, I just saw that we could actually import it's probably, I can take that on. Check to see something. How it's going. Yeah, just as I said, because it's a really cost a lot, keep a microphone as they said, and from hospital and the home or something like that, it's actually cost a lot more. And if they can get help in the right way. So, but I will check it out. Instead of the proposal how. So that's why I asked you money, estimate, if they already have 3 years, so they already have the cost. And also the results, right, they give you the results on the analysis from all the consequences of how the work, if it works well or not, or just because they said that the very low participation in the meeting. So they made a meeting, then that's it. So just try to understand how this activity, how they run this part, how they run this, how they maintain the work.
So those were trainings. So the one that we
They just
did,
changed.
activity 2.1.3, those were trainings. They did trainings, I don't know if they were virtual or in person, they might have been both. But they did trainings on how families can navigate those systems, how they can navigate the developmental disability system, behavioral health system, and managed care organizations. So how do you navigate all those when you have a dual diagnosis? If you have two diagnoses, behavioral health, and developmental disability, how do you navigate those systems to make them work for you? So they did trainings, and so I think this particular, the concept paper that you're talking about, I think they want to do something a little different, but the cost is a lot.
So they just, this year, they provide a different.
It's a different
It's a-
approach.
And it's
Oh,
a
yeah.
different, so that's not the vendor for this activity. This is a different organization that sent in this concept.
Yeah.
So the council allocated the $30,000 and we sent that out for, proposals. We solicited the proposals and then the council selected who they wanted to complete that. This company, Mirke, or I'm not sure if I'm saying that correctly, but they sent this in separately, so they didn't apply for the solicitation of proposals for this activity. So they said, well, this is a different approach to do this. But their quoted amount for how they could do it is over $1 million annually. Yeah, I'm not sure. I don't remember. It's been a while since I've read these.
And I'm hearing, I don't know if they actually go into specifics about how they would do it, so I'm not sure if they're gonna be doing trainings. It sort of just seems like they listed expected outcomes, but they didn't really go into any detail about how they would actually do it. Yeah.
So this number, they gave you not more estimate. They gave you the estimate.
Yeah, it's included in their concept paper. It's on that second page. They break down the cost of how they got to the 1.5 million. I mean, 1.25 million.
Eventually, whenever it's appropriate.
So, it seems to me they will tell you how they are going to do it once you hire them. So if you read the very bottom of the paper there, seems like they've had a patent on it, right? On the process on how. So they think it's a unique way of doing it that nobody else have done. So.
So for the concept papers, they give us all the information.
Oh, they do?
Correct.
Okay,
So,
how?
so
Okay.
we solicited for concepts and just said like, if you have a concept, send it in. If you want the committee to take it into consideration for the next 5-year plan. And so there were specific things that had to be included. Cost estimate was one, like a overview, and then I believe just like what your plan was, like a very short plan. Whenever we do the solicitation of proposals, which is a little bit different, we kind of put out almost like when you put out like a job kind of, right? So we say like what things we're looking for and what goals need to be accomplished. And if you think that, you can do this, then you send in your like your proposal, but within your proposal, you get to say how you're gonna do it, as long as you're reaching whatever goal the council is looking for. Which is why some of the things say like, okay, well, we need more guidance on this because we're trying to figure out how to send out those solicitations to make sure that we're meeting the expectations and the goal for the council and what y'all wanted the activity to be. So I guess it kind of goes both ways. Like, yes, they give information and they can kind of plan it, but overall the goal is what the council wants, and whatever their plan or the activity, it has to fit into that goal, or we need to have that discussion with the contractor to say like, hey, this is what the council's looking for, and we need you to make sure that you're reaching this goal.
Got you.
I don't know if that helps.
Yeah, that does.
Yes, ma'am.
To talk about, by the way, my name is Nicole Dejon, and I'm with Disability Access Solutions, Baby Policy's company. I wanted to talk about the topic, it looks like it's on the third page. I think it was submitted, it's create a resource guide by compiling emergency plans for parishes, especially as it relates to individuals with intellectual and developmental disabilities. We were the ones that submitted a revised recommendation. Because when we saw this, we were really excited about it, because the company currently is doing a lot of work across the state and with Texas, looking at emergency preparedness plans as it pertains to people with disabilities or the lack thereof. Because what we're finding is that in a lot of parishes, a lot of entities, individuals with disabilities are not included in, or they're included, but in a very inappropriate or minor way that doesn't allow for appropriate emergency preparedness. Preparedness, resilience, recovery, all the things that go into disasters. So this is a super important topic, but I think the way that it was suggested wouldn't have the impact that the council would be looking for. Because the way that it's suggested right now is creating a resource guide based on each parish's emergency plan. And each parish does create their own specific emergency plan for their citizens, but it's really designed for the emergency managers to create a plan, like kind of a macro, a big approach. How are we going to keep the parish safe? Not necessarily, this isn't a document that the average citizen can pick up and really say, okay, this is how it applies to me. This is how I can keep myself and my family safe. And these documents generally are about 200 to 500 pages long. And it really takes somebody with some expertise to cull through that and figure out, kind of glean that information of how the citizen could use it. So our recommendation is actually based on some work that's being done with the Texas SILC. So the Texas Statewide Independent Living Council, they currently have a peer-led training program that's happening over there for their citizens with developmental and intellectual disabilities, specifically on the Gulf Coast. So what they're experiencing there, their emergencies and disasters really align with what we have here. And so the way they've approached it is they are training individuals with disabilities to be the emergency trainers in their own community. So they're taking kind of a two-pronged approach to this, a workforce development and an emergency preparedness, personal preparedness approach. So the individuals with disabilities are within their own community, providing the training to other people with disabilities. So you've got that preparedness piece and the workforce development piece. We think that that's something that could be emulated here as well. So that was our recommendation, because again, this is super, super important. There's a big gap for people with disabilities and emergency preparedness. But again, the way that it's being presented right now, the average family or individual couldn't take a parish plan and create a plan for themselves and their family to stay safe. So. Does that make sense? Okay.
Yeah, can I ask a question?
Yes, sir.
I'm sorry.
It's okay.
I'm out of order.
No, it's okay.
Does the state, has a centralized or someone that is, appointed or in charge of everything that has to do with people with disability? I mean, like, we have a president of the United States, so he's the one that is in charge of us, right? So, I mean, is there a single point of contact, like all of these things, and so is that person? Or, school district do their thing, we do our thing. For example, now, people with disabilities cannot read those, 200 pages of information, right? So, is there a centralized person that is in charge of everything that has to do with people with disability?
Are you talking about on the federal? I mean, I guess.
No,
Are you talking about
on the
state
state level,
level?
state level. We don't have that.
No, I would say no, we don't have that. Now, there are resources that are single points of contact, and I would say Families Helping Families
Yeah,
is a resource where you can contact them about all things disabilities.
yeah.
And they will try their hardest to get you resources,
Yeah.
but I don't think there's a single person within our state government that is specifically in charge of all things disabilities, no.
Okay.
No, there's absolutely not.
Well, then there's the catch.
That's what the issue is.
Yeah,
That's definitely an issue.
right?
Mhm.
That's.
I mean, we can point to, to one, but hey, there was a hurricane, in Southeast Louisiana. Why wasn't this person at this, zip code, get evacuated? Okay, we're gonna answer that question.
But that's why this is so important, because people need to be able to make their own plans based on their own needs. Because we're seeing that at the parish level, people with disabilities are not, the resources are not necessarily there, the knowledge is not there. So I would encourage you guys to definitely lean into this one, or to consider this topic, maybe not in the way that it was originally presented, but I would encourage you, the model that's being used in Texas with their statewide independent living council really gives people tangible skills to be able to help themselves, so they're not so reliant on maybe a governmental entity, coming in, because people with disabilities know their needs best, and you can make a plan that's best for you. But we have to be able to have information that we can use that makes sense to us. I'm sorry.
Yes, sir, Mr. Taylor.
I must say this, and the chair could correct me and the board could correct
I
me.
don't know if you want me to do that, but go ahead.
Be quiet.
Hang on. A lot of people, and I'm being truthful and I'm being honest, a lot of people don't want to take that risk. And when I say take that risk, I'm being responsible of people that's got disability and being trained with helping people with disability, with medical stuff. If I'm on the track of what I'm trying to say to y'all. A lot of people just don't want to take the emergency risk of assisting, helping, because a lot of people just not trained. And they so scared of taking that risk. And when I want to say 5 years ago, 6 years ago, my daughter was totally disabled where she had to ride around with an ambulance. And a lot of people were scared, okay, what to do, because she can't swallow, she can't eat, but she can't do this. What I'm trying to make a point at, a lot of people just don't want to put things in place that would help people. that needs what they needs to be trained to what they need. And I'm just being honest, if I hope I'm on the right track of what I'm trying to say. To put a plan in place, it's easy to put a plan in place. But is it easy to follow that plan? It's hard to follow that plan, but you could put it on black and white. But who is trained to really follow that plan? Oh, I know by how many people gonna jump in. Or I could do it by how many people gonna jump in. Cause when they see machines and all the stuff that needs to be put in place, oh, I'm not trained. I'm scared. It's easy to ride an ambulance and not be trained. It's easy to be a police officer and not be trained. It's easy to be a fireman and not be trained. To the disability community. And if you're not trained to walk that road, it's easy to put it in place, but it's hard to follow it. That's all I have to say.
Can I add something?
Oh.
You're on the-
Go ahead.
Okay, to build off of what Mr. Eric is saying, that's what we're seeing, is where there's kind of a concern and a lack of understanding from the emergency managers about different disability related issues. So like you said, okay, how do we evacuate, or how do we engage with this person or their family with disability? So that's why we're seeing where it's super important for individuals and families to be able to have that plan for themselves, to be able to help themselves as much as possible, because the gaps are there for exactly what you're talking about. People going, oh, wait a minute, they're concerned about it, they're scared about it, they don't know, they don't want to do the wrong thing. Is it a liability? That sort of thing. So that's where education in the disability community is so important. I appreciate you saying that.
So,
Yes, sir.
She
over there.
had her hand raised, but then Jill also had her hand raised.
Okay.
She put it down, so I'm not sure if she still has a question, but Constance, you're first.
How did the Texas Silk go about this, and what were the costs involved?
So the Texas Silk currently has a grant with the Moody Foundation, which is a big foundation that only funds in Texas. And so one of the ways that they addressed it was they've partnered with the CILS, the Centers for Independent Living in Houston, Beaumont, Corpus, and Galveston. So they've gone out and they've done focus groups, which we've been able to attend as well, to figure out, okay, what are the concerns and the gaps and experiences of people with disabilities in evacuations and disasters and recovery. So based on that, now they're recruiting individuals from the CILS to be the disaster resiliency specialist. So those people will go through a training to become that community-based trainer. So even once the funding ceases, those people are still embedded in their own communities as and consumers of the CILS. So they're able to continue with that training and that knowledge expansion. So the idea is that you've got that kind of that two-pronged approach with the workforce development. So they've got training and presentation skills, but also the emergency preparedness information is distributed in the community from the community. So, does that answer your question?
How much did the foundation?
So their grant was fairly large, but that was to hire a program coordinator, technical assistance and evaluation, travel, there's a lot of expenses that we wouldn't necessarily incur if we were to implement something like that. So I can't give you a better cost for that, just because theirs is a fully built, like it's a staff member in their cell that they had to hire.
I guess I'm just thinking like, they have this big grant to cover that. We're looking at $30,000. What can we realistically do? with
Right.
$30,000? This is a very real need.
Absolutely. And I think we can scale it to where it would be reasonable. It wouldn't be, because they're also covering fairly large territory, because you're talking about Houston, Beaumont, Corpus, and Galveston. Those are, you know, they're similar in what they experience as far as disasters and emergencies, but territory-wise, that's really large space. So we wouldn't need to necessarily cover that kind of territory. We could, you know, there could be an initial phase where, you know, depending on how you guys build it out or however it's built out, it could be certain, you know, certain areas. I think, you know, our thought would be the resources and things like that are fairly limited in North Louisiana. We get a lot of focus in South Louisiana because we experience hurricanes, we're well versed, there's a lot here. North Louisiana is fairly lacking in some of those things, especially emergency preparedness for people with disabilities. We saw that in Winter Storm Fern. Families and individuals were hit and very isolated during that event. So North Louisiana may be the area, you know, to focus on because of that. Does that answer your question?
Yes, sir.
Oh, I was just gonna provide clarity. You could potentially have more than $30,000.
Okay.
Just so y'all will decide what's your most important activities and you'll fund them appropriately based on what your vision is. But just keep in mind, historically, the council has tried to do a lot. So you end up just putting a little bit of money towards everything you try to do instead of actively focusing on real big picture and maybe putting your money into a few big projects instead of, you know, 10 different contracts where you can only pay $10,000, $20,000. So that might be something to consider. But if you're really passionate about that particular item, you could put more or less depending on what you envision. But I would imagine we'll talk more about that when y'all get to the budget part further down the agenda.
There is a hand raised. Jill, did you have anything to say before I let the public speak?
Nicole, check your text. Thank
Okay. Check your text.
Check your text.
Oh,
You're being beckoned.
Bambi and Ms. Kosei have their hand raised.
Yes, ma'am, Ms. Bambi.
Hey, you guys, can you hear me?
Yes, ma'am.
So Nicole did a great job of providing you with the information about this particular project. The one thing that I would just add is that Disability Access Solutions also has a contract with the Governor's Office of Homeland Security and Emergency Preparedness. And so the work that we're doing there is not this specific work, but we are working in every region of the state, providing trainings and doing collaboration building in every region of the state. So I think in response to Constance's question, and Nicole responded appropriately, like the costs, we can mitigate some of the costs because we're going to scaffold some of the work that we're doing and be able to build upon that. So I feel like we will be able to do the work. It's not like starting out at nothing. We already have some other components of a very complex issue around emergency preparedness. We have some other components and we can build upon that with this, which I think is a very exciting opportunity to, and will really be able to engage people with disabilities to actually do the work. So that's all I have. Thank you, guys.
Yes, ma'am.
Ms. Brenda, can you hear us? You have permission to speak. You have the floor.
Good morning.
Good morning.
Oh, yes, I wanted to ask about the voter training. Was there reconsideration for that?
So we hadn't talked about it, Ms. Brenda. I mean, if you wanna like, let the committee know.
Are we on that or did I skip?
No, you haven't skipped. If you wanna let the committee know how you feel about the training, you can.
Oh, okay, great. I know that it states that we did this initiative in 2024, but in one of the statewide input meetings with LaCan, we discussed about having trainings where we could have videos and maybe some type of publication that was geared toward, again, voters with disabilities. And it was in line with the Employment First training that we did. And then the planning committee made a recommendation for us to have videos and virtual types of training. And that information is still available on the DDC YouTube page. So we were discussing how to take that voter training that was done apparently to have it where we have something put onto the YouTube page for people to be able to come and look at, you know, ongoing whenever they are interested in going to vote. Thank you.
What was the 2024 voter training on? My thinking is around like how there've been changes recently on voting requirements and parties and whatever they're doing, whatever the party system is now, you can only vote.
Talking for the primaries.
Yeah, for the primaries and no party.
Okay, there we go.
I mean, I don't believe it covered that particular aspect because that's a more recent change, but it would have covered other things such as how do you register? What's the
How to use the
importance of voting?
It went over.
Using the machines, because the Secretary of State's office would come out to the trainings and provide actual machines that they could walk through and utilize. So it's kind of those aspects. If you need help at the voting place, who do you ask? What do you look for? Who you can contact ahead of time? That type of.
I put up the final report. I didn't include this in your packet. But I put it on the screen. This is the final report for the disability voting rights training. It does say that they went over why you should vote, the process of voting, assistance and accommodations with voting, your rights and responsibilities, and the meaning of the constitutional amendments. And then this is just the breakdown, like the attendance breakdown for those trainings. They did 10 trainings. But there's the information, but that's all I have about that.
And I think what Ms. Kosei was bringing up, Ms. Brenda, her comment was like the employment seminars that we have on our YouTube page, that it's a video where people can go back and reference those videos if they want to hear about employment. She's saying instead of doing a training similar to what we've done already, to actually make something like a video to show people why they should vote, what their constitutional rights are and responsibilities, like turning it into a video instead of an actual training so people can go back and reference it later. I know there'll be changes, like there were changes for the primaries, but at least most of the information probably will stay relevant, like who they should contact probably if they need accommodations at the polling places and things like that. So I think that's her idea of continuing the training, but not doing the same thing that the council has already done in the past.
Yes, ma'am. Yes, ma'am.
Obviously, I have lots to say today.
Okay.
So the web-based training that was done in, I guess it was 2023, looks like, do we have that video where it could be like a starting point of addressing some of that?
So,
Could that be something that we start doing, that if we're offering web-based trainings, recording them so that then they can become training tools that can be used later?
I think that would be something we will maybe need to put into the contract itself. But yeah, that is something that we can probably do.
and I think it would depend on the intent of how you want to use it, because a lot of, so for instance, that particular voter training, it was important to attend in session because the machine was there. And then if we had the web-based, if we made it available before, you know, these trainings were offered in person, then you might get less of a response to those in-person trainings if we make that web training available. So you could, like Ebony said, include it in the contract, but we'd have to be careful if we release that. Would it discourage attendance from those in-person trainings?
Yeah, and I was thinking like, once that year is finished, like once you've done all the trainings, then this becomes our set. So now with 2024, it's 2026 and we're having this voter training. Well, this is where you go get this information. This is the only that we might need to
Yeah.
add on to.
And that could be something also in consideration if the contract is ending. Certainly if it's gonna continue in future years, then you would wanna let them build, for instance, like Team Dynamics. I think every year they do it, it gets tweaked a little bit because you learn and then you do additional things. So yeah, at the end of that particular initiative, then we can make something available possibly.
Yes, ma'am.
One of the public comment suggestions was that, it's the first one under the 5-year plan, public comments, a program for all community parks to have recreational equipment on those playgrounds for all types of disability. The note is legislative advocacy, which I do agree with that. I'm thinking back to one of the meetings we had last year with Lieutenant Governor Nungesser. I'm wondering, can we use that possibly as a piece? This is his pet project, doing some things like this. And he made himself available to us. So can we use to start maybe building upon that relationship to kind of address that? For the community parks? He had this whole plan about lotto tickets. I don't know if he got a bill sponsored this session about it, but he had a plan.
We'll say as far as bills, I have not seen one. Unless it's something buried in a bill that I didn't catch, but I haven't seen anything yet.
Ebony, will you please review the budget?
I'm gonna, I'll just go over it. Yeah, I'll start,
Okay,
just. Sorry, I'm trying to share. I'm screen and I'm confusing myself. Okay. Shares, there we go. So. You have the budget in your packet. It's also one line and it's linked in the agenda. So I would say that the budget and then the status report, they kind of go together, which is why I put them on the same agenda line. Because I built the budget based on staff recommendation. And this is a draft, so this is if the committee follows the recommendations from the staff. This amount right here, this $259,000 is the amount of money that the committee would have for any activities you would want to fund for this fiscal year. That's all that I can think of at this point.
I don't think I have anything to add. Stephanie just already covered, of course, in your 5-year plan, we want to continue doing partners and policy making. And then all of the other activities that are there, LaCan, our grassroots advocacy network, our advocacy events, which basically pays for our roundtables, yellow shirt days and things like that. So we of course want to keep the youth leadership forum and then people first. There is a mandate, a federal mandate that the council does have to support the self-advocacy network, a self-advocacy network within Louisiana, and the council has throughout the years chosen People First as our self-advocacy network that we support. So there is a mandate for that one. And I think that's all I had to add. You guys have any questions about any of those things, let us know.
So I, just to let you know about the document, this is just like the working document that I'll type in as we talk about any kind of funding you want to add to any initiative. So it does, I think I put I tried to do like the amount that was here to give me this number, but whenever I add down here, I'll try to have like a running total of the amount of money that you have left. I'm not sure if I'm making sense, but that way you know how much money you're working with as we're adding those activities with the funding. Okay.
Excuse me, sir.
Chair, may I roll up to the table and speak?
I guess so.
Right there, that's what I said.
So Ms. Emily, you said that we have to stay with the one you just called out, that definitely have to be, we have to pick somebody. Definitely, and like around the other day, and all that, we have to keep that in no matter what. I forgot the first name you said.
Okay, yeah, so you guys don't have to, you don't have to keep these activities, but we're, as staff, we're recommending that you keep these particular activities. Number one, Partners has been excellent over the years in creating new advocates for our state. And then LaCan is our grassroots advocacy network. That's what allows us to have the LaCan leaders.
Correct.
And LaCan members to go out regionally before session to talk to legislators. But then while we're in session, they're showing up to the Capitol for Yellow Shirt Days to help the council to push your agenda. Advocacy events, that's what pays for the roundtables, like what you were saying. But any other advocacy event that you guys wanted. And then the Youth Leadership Forum, again, it's like a mini Partners almost, where they're taking high school students and they're teaching them independent skills and then advocacy skills as well. And then the last one, People First, is your self-advocacy network in Louisiana. And the council we have to support a self-advocacy organization within Louisiana. That's a federal mandate that has to be in your plan. And so the council has chosen People First, and we've been supporting them for years.
Yes, sir, Dr. Mehta.
And 1, 2, 3, 4, 5, and we are happy with all of them, with the job that every one of them doing.
So that's why Stephanie said this this budget and the stuff that we're recommending goes with the status report, so you can see the status of those activities and the staff's recommendations.
Okay.
If you wanted to go ahead and look at those, it kind of goes hand in hand. So.
I'll pull up the status report right now, and we can, if the chair would like, we can move on to Matt.
Yes, ma'am.
Since we're kind of getting into, that discussion.
Yes, ma'am. Yes, ma'am, go ahead.
So as you're moving in, because I think it kind of goes, I wanted to see like, what are the members' thoughts on, instead of funding many small activities, funding a couple of larger things that may be bigger. Yes. Since I've been attending council meetings, there are several issues that come up. Transition comes up every time. There's always a meeting where transition comes up and something with transition. Recently it's been, benefits things like around social security and stuff like that. And then I would say something, early childhood education, it has kind of been back and forth.
Yes, sir.
My thing with benefits, and y'all can correct me on that, we don't have nobody. I'm gonna just throw it out there, SSI, we really don't have nobody to come to the table and to really give us reports on that, to where we can get a better understanding of what's going on with that, because as a circle, we hear so much information, and then when we really look at it, we don't know what to believe. We got somebody from Medicaid that sits on this board, but we don't have nobody from SSI, what we can do or what we can't do. Till we scared to make a move. And personally, from me, I'm gonna speak for me. I'm scared to make a dab because I'm probably lose this because I don't know this. And we can't get nobody to come forward and really tell us the truth. Okay, if you do this, you're gonna lose this. If you do that, you're gonna lose this. If you lean forward, you're gonna fall out this chair. So we really don't know the truth. So where do we go? We don't know. Cause we get people say, well, I'm gonna look into that. I'm gonna see. I'm gonna find out. I'm gonna figure it out. We're gonna look at this. We're gonna go back and look at this. And we still don't get to look in. We don't get it. But we can sit at this table all day long. And if we don't get the true truth until it's on black and white, oh, your check gone. What to do then? We lost.
And then there's nobody that's
Gonna
gonna
take the blame.
take the responsibility for it.
I make 2,000, I'm gonna get 100 taken from me. If I save 3,000, you gonna get your check taken because you're making some money somewhere. If I go get a house, I'm counted against that because, oh wait a minute, you got a house. How you get in? Makes sense to this. Just trying to see. If the born arrow go through this water, where it's gonna go? All over. Nobody takes accountability. Just trying to figure out. So if we gonna shoot at them and try to figure out things, or go bigger, we still gonna be up on. There you. 12 years for a wheelchair, my wheelchair could be having me on the floor. And we see you. We gotta go through this paperwork.
Make sure you're still disabled
Yeah,
before
let me-
we, you know,
Let
let's
me
make
send you to the
sure,
doctor.
you know, you didn't start running overnight.
We're gonna see if you're disabled, but you see it. Oh, yeah, you're right. He is disabled, so you need a wheelchair. But let me figure it out on paper that you can get it. Right now, y'all, I'm begging for a standing frame, begging to stand up. Oh, but let me put it through the paper. Oh, they denied you. I need $60.
Did you say 6 7 hours?
Big blank. So if we do that, what's gonna happen? We're gonna get the what ifs. That's all we say. People's first. Yellow day shirt, that's our time to speak up. That's our time to find the people we need to talk to. That's our time to get them to listen to us. And not be a number. That's our time to turn around and say, hey, we out here. What out? Hey, we need. Well, there's a few people that's begging. But if we come in a circle, then they might listen. But if we know our people, might get some help. But we gotta get to know them. Yes. Oh, I'm sorry.
Eric over here running the meeting.
Yes, sir.
Taylor, talking about, who is who is responsible? So this is the Governor's Office of Disability Affairs, okay? The first sentence says this: the Governor's Office of Disability Affairs strives to serve as a resource for people with disabilities, their families, and the agencies they serve. They don't take no responsibility. They're there for you as a resource. They are not responsible for nothing. That is the first sentence on the Governor's Office of Disability Affairs. So I think that summarizes everything you just said.
Friends.
Yeah, I was just gonna, so I was thinking of it when Eric had first started, but I was waiting. I think sometimes as council members, maybe you don't know or understand the influence you have and that you can have within a council meeting. Because a lot of what you were talking about, if I reframe it for focus of developing this plan, a lot of that does involve advocacy, which isn't necessarily an item that we would have to put a dollar figure on in this particular plan. Oftentimes, so specifically, a lot of what you talked about could be handled in the self-determination committee. A lot of times we sit in our committees and we sit there in our department reports and there's silence, or maybe there's one issue that we talk about and then we move on. And that's where this is supposed to happen, where we engage in these conversations and we as a council, you as a council, hold them accountable for statements that they make, for the way that they answer questions, for the processes, require them to come with follow-ups, submit letters on behalf of the committee and chairs that would say, hey, we're asking you to do X, Y, and Z to make a change to this particular item and let them explain why they can or can't do it. And so that's the process of holding them accountable. I think often we want, folks to be held accountable, and we think within their department or within their agency or their organization, someone should be holding them accountable. But you as the council are responsible for holding them accountable. You have the charge of monitoring the community and family support system plan. And so, you know, they might want to be a resource, or they might want to just provide you with information, but you have to hold them and hold their feet to the fire about what it is that you want to see changed and what you can ask them to do. The worst they could tell you is no, and then you just find a workaround to ask it in a different way until you get a yes and until we can make some changes. But more focused on how it relates to the plan. A lot of that, I just encourage y'all to use those sort of concerns and issues that you have to sort of drive the committee meetings and what's discussed in those meetings and what's discussed in council meetings. Because I think to accomplish some of those things, you don't necessarily have to have it in the plan tied to a dollar figure. You have some of these advocacy issues that have a dollar figure on them. And so when we find out, let's say from a department that, oh, we need $10 million to make this change, then we know we have that advocacy and that's already funded in our plan that we could then push to get money from the legislature and do those types of things. So I just wanted to throw that out there to help y'all in your decision making and in your next meeting in April. Or next 4 meetings, I guess, in April.
Yes, sir.
Can I ask a question? I mean, anyone have a number of the population of people with disability in our state? Like, you know.
Of
It's a, yeah.
of disability or specifically developmental disability?
Okay, wow. Well, people that, yeah, that gets more complicated. Yeah, because I mean, I was thinking about when we're saying keep people accountable, right? We talk about politicians, so which means, well, not just them, but so we talk about numbers. The only way they will be accountable if they know there is 1 million of us that are going to vote. And so that's what they care about.
For, like, specifically for federally, we follow the federal percentage. Which is the guidance from ITAC. I want to say it's like 2.79%, but I could be wrong. I could probably look it up for you, but I don't remember
Yeah, they don't care about
exactly
us.
what it is.
Yeah, I mean, generally 3% has been like the running rate that they've had for years. But I mean, I've seen estimates as high as like 55 million Americans have a developmental disability, which would put closer to, what's that, 16% or something. So
Yeah.
I guess it depends on whose numbers you use, but
Yeah.
I just Googled it, it said 2.3% roughly,
yeah.
approximately 107,000 people have
What about our
intellectual
state?
and developmental disability.
Oh, okay, in our
Just
state,
for Louisiana.
oh, from Louisiana. Okay.
Yeah. Yeah. I mean, I think the going rate is about 3%. Yeah, you can expect of your population to have a developmental disability.
And for just for federally, the reason that we follow like the federal number is because our number is like close to that federal number. The guidance was that if it's over whatever the federal number is, I want to say it's like 2.79. I don't remember exactly what it is, but if it were over that, then they'd want us to use that federal, or the state number, but because we're so close to that federal number, we just stick with the federal number for reporting, like what we report, I guess.
Have something? No? Okay. Yes, ma'am.
Oh, I just wanted to talk about this document, and it's kind of like the next couple of documents that you have in your packet. So this is our planning status report. It has information for each item. Now, this is based on the 2026 action plan. Okay, so this is the current plan that y'all have. So It has a little bit of background information, and then if you, oh, what is this doing? Does not load right? Okay, well, we'll just look at page 1 for right now. I'll open it up in a moment, but if you look at down here where it says staff recommendation, we give some further information for the committee to consider. So I'm gonna use partners, since this is activity 1.1.1 as the example. So we recommend continuing this activity. And then I just gave some funding information. So the funding was at $90,000 for 3 years. So for 22, 23, and 24, that's federal fiscal years. In 2025, we increased it. It was increased to the 115,000 with an additional 30,000 for that alumni event. And from the partners coordinator, that alumni event is going to be every 5 years. So it was just done in federal fiscal year 2025. And so for 2026, it stayed at $115,000. And then the next part is really the part that I wanted to talk about. We recommend moving it to activity 1.2.1 and changing the wording. You'll see all of the things that we recommend. We are recommending where to move it because, and the reason that I want to make sure that everybody understands, the reason that we're saying we recommend moving this activity is because you have a brand new 5-year plan with new goals and new objectives. So if you look in your packet, your next item, your next page, it is that 5-year plan with those goals and objectives on it. So that includes your goals and objectives and just the goals and objectives on there. So we kind of look to see where these activities that we thought that you should keep, so the things like partners in policy making, LCAN, advocacy events, and then some of the other activities that we just recommended keeping that may not have money attached to it, it's gonna have something similar to this. And then the second part of that is they're changing the wording. As a council, y'all have presented, or I guess, instructed staff to make sure that our documents are in plain language. So making sure that these things can be accessed and understood by anyone that reads them. So the wording changes are to take those activities and putting it in more friendly and readable language, so it's not so technical, because at the end of the day, y'all are the ones reading this and you need to know what it means. As if you look at the first one, it doesn't really change anything, but when we get into like goal 2, some of them had a lot of words and a lot of things that even when I read it, I'm like, I'm not sure what this means. Like, it just seemed like a mouthful of stuff. So we tried to make it just a little bit easier to understand. But again, as we said earlier, these are just recommendations. You do not have to accept them just because they're coming from us, or if you think something needs to change, or you just don't want to accept the recommendation as the committee, that is your job. The other thing that I just wanted, well, I don't want to get too far ahead, but I included a mapping tool to kind of help as we're talking about it. Yeah, it's on the legal sheet. To help as we're talking about activities. And the reason I wanted to talk about this here is because it goes with the planning. All these documents are really connected. I've tried to make it make sense, and I hope it's not too much. But if I go back to activity 1.1.1, where it says we recommend moving it to 1.2.1. So the mapping tool has the new goals and objectives. And if I go down to 1.2.1, if you look, I put that activity, that partners in policy making activity on there. Yes. And then the next part is like how long do you want to fund this, or how long do you want to do this activity? So because it is such a big activity that the council does, and it produces a lot of advocates, and it's something that y'all continuously do, I went ahead and I checked all 5 boxes. So that's saying that y'all are gonna do it for 5 years. So for this next 5-year plan. And again, y'all, these are recommendations. This is just what I was thinking as staff from conversations that y'all have had at council meetings and committee meetings.
If I can I add?
Yes, ma'am.
So I think this is a good tool because let's take Nicole's initiative that she was kind of talking about for the emergency preparedness. Let's say you guys, all right, you wanted to do $30,000, and this is all hypothetical. But if you did 30,000 over a 3-year period, that would be $90,000 that y'all have allocated towards that particular activity. So we want y'all to kind of look at things as a multi-year approach. Some of the things that Stephanie had in this, like the committee recommendations, like that first one is like possible study followed by a multi-year approach for transportation. That is something that always comes up, especially access to public transit systems. So we know transportation is a huge issue in Louisiana, but it will be a huge undertaking. And so the recommendation was like, if you guys want to do something in transportation, maybe do a study the first year, but it will be a multi-year approach. So it will cross over some of those years. So the first year will be a study. Then we will work with some agency possibly to maybe address some of the things that the study found. And so just kind of want you guys to start looking at things sort of like, okay, maybe we can do this project for 3 years instead of just year by year by year. Just looking at it as a whole, maybe this could go over 5 years instead of just, oh, this year we'll put 30,000 to it and then we won't ever look at it again. So just trying to get you guys to sort of start thinking like that, like looking at it multi-years instead of just 1 year. And I think Stephanie has something to add.
Throwing everything in the bucket.
Right, like throwing on the wall, see a little stick, yeah.
Yeah. So,
I just wanted to add one other side note that's more, it's more administrative, but y'all may not know this. When I submit our state plan for the year, I'm not just submitting 1 year. They want 2 years of a state plan. So they want whatever year is like upcoming, and then they want the year after that. So I do my best to just kind of predict from conversations, like what that might look like, or, you know, if we've done this activity for 3 years, I'm like, oh, well, they might not want to continue it after 3 years, so I'm not going to take it off. Now, they do allow for when that year comes up for us to go in and make any edits. So I don't want you to think that it's like concrete, you need to have 2 years planned out, but at least having an idea will make it easier when we submit that information to the federal government to show like, oh, okay, well, they're going to be working on this for, you know, at least 2 years. And then I don't have to go in every year and add one activity, you know, all these activities, because we weren't sure how long it was gonna take. And that's maybe a little selfish of me, but I just wanted to let y'all know, what it looks like on the back end for us when we're submitting those plans.
Hey, work on it, what's on? Right there, exactly.
But then it also helps like next year for the planning committee. If y'all have these planned out and say, okay, well, we're thinking about doing this, you know, year 2, 3, and 4, then we can bring this document to the next planning committee and say, oh, look, at this planning committee last year, this is what the planning committee was thinking. Did you want to adopt this? or, you know, what other activities do you may want to add, or, and that way we kind of have a foundation when we go into those discussions of what the plan may look like.
Yes, Simone. Shit. Go ahead.
Well, I mean, yeah, to me, it's all about accountability. If we, you know, we're gonna give you $115,000, you know, I want to know what you do with the $115,000. Yeah, I mean, like Taylor, I mean, we need to keep people, organization, whoever they are, accountable. And if we're happy with all five, that's why, I said earlier, so if we are happy with them, they're doing a great job, and we have a way of, you know, checking the box, they did a great job. Yeah, so let's continue. Let's continue. But they have to be accountable for what they say they're gonna do. And then we have a way, we have a matrix of saying, you know, family helping family, okay. Out of those 10 metrics, you only satisfy 6 of them, we are cutting your funding, we're going to somebody else. Well, I mean, it's not that drastic. You know, I mean, yeah, I'm all about accountability.
So if y'all want, sorry, is it okay if I?
Yes.
We can go through like the contractual for each goal and kind of allocate those funds first.
Sounds perfect.
And then that way, you'll have like all the money stuff out of the way. And then go into those non-contractual items. But we can start with goal 1 if you would like. And I also have, I'll share. I'm gonna share this document instead, only because I'm gonna be typing. Unless y'all don't want me to share it, if it gets too confusing, let me know, or if there's something specific that you need me to share. This is just a draft of the plan. That way I can type in the activities and the goals and, well, I have the goals and objectives. I did, just like I have on here, if I put it under like these activities right here, they're the same ones that are on here, but if you want me to move them, just let me know. I'll move them wherever y'all want. These were just the staff recommendations of where we thought that they may fall.
Yes, ma'am.
I just have a question. With the goals and the objectives, they're not like measurable. They're like a requirement. They don't have like what we're trying to get towards.
For specifically for our plan, the activities are the measurable part. So when I submit, I have to say like what do they call it? When we go in and we submit everything, it has like the number of people trained. What do they call it, like evaluation strategy. Shoot, I can't think of, but we put it in for each activity to answer the question. I understand, the way that when they wrote the goals and objectives is that the goal is broad and we go down, very specific for the activities. So specifically for the activities, those would be more outcome based, I guess, if that makes sense, and ways to evaluate the actual activity. We have to go in for each activity and say like what we're measuring. That's what it is. It's like a measure.
So up front, do the activities like provide funding, support and technical assistance to strengthen the self-advocacy network? Like, how do you, like, how is that measured? Like, what are we trying to get to?
Activity or.
That's activity 1.1.3. It was just the shortest. It was on the first
The
page.
self-advocacy network. Okay, yeah, that one.
People first. I think this goes back to, what Dr. Mehta is saying about accountability too, because they're good, but like, how do we know? You can't hold them accountable if you don't know what you want them to do.
So that one is, that's the one I was saying that's federally mandated. So with that particular one, that's for people first. And so I would say this is why the status report is so important. And I know we spend a lot of time on the status report because we're trying to give you all updates. So we put the information about what they're doing and what they've done with the funding that the council gives them. So whether or not that be supporting self-advocates to attend the disability policy seminar in DC, or if we are supporting them to attend some type of other leadership training, maybe in Louisiana or another state, that's where that information will go. I understand what you're saying, where it's not in the actual activity that we're gonna train 20 people. And then, okay, let's measure if we train those 20 people. With some of the activities, it's a little bit more difficult for us to get honed in on something like that because it changes every year. And I will say with that one specifically, it changes every year. So the contractor for that is the ARC. And so they may send 5 people to the disability policy seminar in DC where they're getting actual Capitol Hill visits with legislators. But then the next year they may only send 3. So it's kind of hard for us to hone in on like, hey, we want you all to train or strengthen the network by 20 people by doing this. Because we don't want to make it so specific where that's all they can do. And so sometimes we make the activities a little bit more broad too, so that they can, I guess, navigate and so that they can be flexible as well. Now, if the council is wanting to see more specifics, then that's something that we can add for sure. If you guys want to make that recommendation to the full council, that is something that we can add. But I'll just say historically, we have not gotten that specific just for those reasons, because we want them to be a little bit more flexible with what they can do with that funding and how they can do it, if that makes sense. Does that make sense?
I think what I'm hearing is you kind of give them a direction and they get to choose how to implement it.
I guess so, yeah, in a way.
So what you're saying is we.
Go ahead, no, I don't have anything else to add.
Got no hair.
You can talk to him though. You can talk to Abe.
So what you're saying is basically we keep them on their toes, they're not really knowing what we going at, we just keep them where they flexible, where they hit different angles of things they need to hit, that's when
Yeah, sort of in a way. So I guess this one is a good one for us to use because with People First, they just do different activities. Now, what they do every year is they host a conference. So we know every year they're gonna host a conference. So if you guys wanna say, we want you all to host a conference and at least have 50 self-advocates attend the conference, that's something that we can definitely add because that is something we know that they're gonna do every year. And then even for activities like, let's just take the transition training real quick, because you guys are doing one. If you guys wanted to get as specific and say, we want 100 families and individuals with disabilities to be trained during that training, during those transition trainings, we can add that information so you guys can have specifics in those activities. We just haven't historically ever been I guess, as specific as that in your activities. Yeah.
Yes, ma'am.
I guess when I can appreciate the qualitative and the quantitative, you know, from all of that, and I guess I just wondered too, if you put a hard and fast number, like we want 100 attendees, then what are the consequences that the committee or the council's, you know, implying if they've done their due diligence and they've advertised or done whatever, they had 75 people, so they've not met the required 100. Boy, they were really close at 75. And there's some variables that play into a lot in the disability community. I wonder, like, how do you, from an education perspective, I get the need to be specific with, you know, with some of the language, but then from the disability perspective, the flexibility is needed. So like, how do you intend, when you put those hard and fast, how do you intend to impose the consequences if they don't meet those numbers or the quantitative piece versus qualitative, I think is what has to be considered. Just a thought.
I think Dr. Mehta and Constance might have had that.
Good.
But historically, there's a reason why it's a little bit, I don't want to say vague, but, you know, broad, so they know what they're doing, so they know best. And that is why, right? So like, you know, there is no quantitative, well, okay, you're gonna have a meeting that, like you said, you're gonna have a meeting every year. We know they're gonna have that, right? And so there is no need to put a number into it because we know they're gonna do that. Right, so that's why historically it is that way and there is no matrix on, okay, all right, you must have one meeting per year, right? Okay.
Yes, ma'am.
I don't know if Constance wanted to go, but I just wanted to add one more thing. A lot of the specifics like that are also in the contract that we give, like they sign off on. So it does say, like, for example, that they will host one conference per year. They will, you know, send people to the disability seminar. So it does outline those things, those very specific, it doesn't, maybe not as specific as you're looking, like it doesn't say you'll have at least 75, you know, self-advocates come to the conference, but it does outline at least the main activity that they're doing. And we do outline, like, you need to make sure that you're sharing the information about it, you know, you're advertising for this. So they're very specific in that contract that we don't add on here, just because we're monitoring internally.
And they send in report, I'm sorry.
Okay, I mean, did you have something to add?
I was gonna say, they send in reports to let us know too, so we put it on a status report to keep you guys updated once a quarter.
So that is what I was gonna add. This is why this document that we give y'all every quarter is so important. And the staff spend a lot of time monitoring the contracts, making sure that the contractors are on schedule. And if they're not, yeah, we're asking a lot of questions, but it's important that the council asks questions too. So whenever the staff is giving contractual updates in the committees, so the Self-Determination and Community Inclusion Committee, that committee is responsible for goals 1 and 2. So if you're assigned to that, or if you are appointed to that particular committee, you should be looking at the goals, are the activities and making sure that, okay, well, what are they doing with this? What did the art do with People First this quarter? Or what did Partners in Policy Making do? What sessions did they have? What did LaCan do? You guys should look at those things because we're updating you. And if you have questions, of course, ask, because it's our job to hold the contractors accountable as your staff. We want to make sure that the things that you all wanted to get accomplished for your goals and objectives are being accomplished. And so this is why this document is so important that we give you all every quarter. And so just keep in mind, if you're on education and employment, goal 3 is your goal. And so you want to make sure that you're looking at those things, even the ones that are not contractual. The things that we're saying that we're gonna hold LDOE accountable with monitoring the school systems. That's stuff that we should ask them during the committees, like Brenton said. We need to make sure that we're asking those hard questions to them. Even the stuff that Constance brought up earlier, well, what is the trainings for paraprofessionals? And how are education units? It's important that we ask them that. And that's why those agencies sit on the council.
Can I follow? I mean, let me reverse the question. Instead of we asking them to be accountable, who is asking us when we send this thing to wherever? We said, okay, hey, family helping family gonna do A, B, C, D. That's what, you know, we put on our budget and proposal. Are they holding us accountable for what we said family, helping family going to do? Like when we submit, I mean, we submit these budgets to the state, right? I don't know. Well, I mean.
The plan goes to the federal government.
To the federal.
Federal government. I mean, well, I guess my question is, who's holding us? Yeah, accountable. I mean, DDC. So this is why I'm like, okay, well, hey, if someone were to ask, hey, what did we do last year with this? And if the contractor didn't do it, then they put us in a bind now. Now we can answer the question, right? So, and that's why, you know, I'm looking at, you know, so if nobody's asking us for measurables, you know, and metrics, then, you know, then it's okay.
So the federal government holds every DD council across the country, the federal government holds them accountable. All of us get an allotment. Louisiana's allotment is $1.38 million. They want to know what we're doing with that $1.38 million.
Okay.
So every year, as a staff, we have to submit what's called your program performance report to the federal government, which is what Stephanie's talking about. So whenever we're going into that report, let's say a contractor didn't meet what we wanted them to meet. That's something that we have to explain to them in our program performance report.
I see.
And why they didn't meet that goal.
Okay.
And so
What we're gonna do to fix that
Yes.
next year.
Yes, so
Got it.
being held accountable, yes.
Okay, got it.
Because, yeah, they're giving us millions of,
Okay.
$1 million. So, yeah, they want to know what we're doing with that funding, absolutely.
And they want to make sure that we're doing what we say we're doing with that money. And that's how we do it.
So, but they don't tell us what to do. We tell them this is the activities, well, that we are trying to do.
They have to approve it, so it has to fall, there's a mandate that says it has to be capacity building, self-advocacy, or
Okay. Got it.
systems change, sorry. I always get them all mixed up. I was trying to think of it in order.
Okay.
But if the activity falls under that, then they're pretty okay,
Pretty-
yeah.
All right.
And we just tell them like, this is the activity we're planning on doing, and they usually don't have questions unless it's something so far-fetched and they're like, this is out of your scope, you should not be doing this, which we haven't had that issue in a very long time, or ever, I'm not sure. At least while I've been here, we have not had that issue.
Understood.
It's usually why y'all doing so many things.
Yeah. So I'll just add, just going back to Constance's question, I guess this is why we don't have like specifics in the activities. Now, again, if the committee wants to make the recommendation to change the activities up and make them more specific, that is definitely something you all can do. That was just something that's not something historically we've done in the past. And I think it kind of goes back to what Nicole said. A lot of things, you know, just need a little bit more flexibility because of the population that we work with.
And I don't think I would necessarily recommend making activities measurable or so versus subjective, at a bigger level. But if they don't require you to put in anything, then I don't think you need to be worrying yourself with that, right?
I'm sorry, I just have one more thing. We do have to put in like what measures to see if they met those goals and things like that. We'll look at kind of like historically how many people, I'm gonna take a training, for example, because those are kind of the easiest because you can get those like raw numbers. We'll look historically, if we had an activity similar to this, how many people showed up to this training, 2 years ago? And we'll kind of base those numbers off of that and say like, okay, on the contract, we might say like, have at least, 100 people attend 100 participants, and then that is reported in, and that is our like goal for federally. And so we'll say like, okay, well, they didn't reach 100, they reached 75, and that is, we have to like make up a scale. I'm getting really deep into it, but we have to make up a scale, like, is it satisfactory, is it were they unsatisfactory? And kind of like, where do they fall on that scale? And so, and then we have to give justification saying like, okay, well, even though they weren't like meeting the expectation, they almost met the expectation. So we're still gonna give them, 1 point instead of 2, because they're still meeting it, or they've attempted to meet it. And then next year they're gonna do they're gonna use this training as their baseline to change it for next year and things like that. So I'm not sure if I've made it more complicated or gave you enough information, but there are metrics that we do need to submit to them, but it's more communicated directly to the contractor and not really on the plan. But like Ebony said, if y'all wanted to include those metrics and those measures, I mean, it's y'all's committee, so.
It sounds like it's there, I guess just on our end, we don't know what they are. Cause it sounds like it's done within that contract. So then we don't know, so I guess on our end, it looks like, well, we're doing things. And we know we want to increase, or like the objective, we want to, make sure that people with IDD and their families learn about their rights and how to connect when we're doing these activities. But it seems like we don't see that end goal, but it sounds like the contract has the end goal in it. So I don't know, and maybe the council sees the contracts and I just don't realize that. Like, that could be very possible.
I'll add this to Constance. So when you think about the council, y'all's job is to let the staff know, like, what do we hope to accomplish? So that's the governance part, right? It's our part on the management side to say, they want this, and so we're gonna make sure that these metrics are met. And so if you look at it like globally or the big picture, you guys are telling us what you want. This is why sometimes we're like, we need a little bit more guidance on what you are looking for specifically. And then on the back end, we're trying to make sure that those things are met, if that makes sense. It's kind of like what Cheryl was saying at that the retreat that you all had, and I think everybody attended that retreat, maybe not you, Aiden. But it's like globally, the council gives the staff guidance, and then it's the staff's jobs to carry out what you guys want to see as far as like what your goals are. Yeah.
And I will add, just for, I guess, more specifics of what might be in the contract. So whenever you get a proposal and you approve it as a council, generally that information is just taken and dropped into the contract. So in a way, you have all the language because they're telling us what they're going to do there might be some small tweaks. And then through it, like in this committee, if we're looking to continue that initiative in the following year, in those recommendations that we would have where we say we might want to change X, Y, and Z, so we might need an extra $5,000 or something, when that committee would approve that and the council signs off on it, and that would be something that's added to the contract. So I think a lot of what's in there is discussed throughout all our committees and our updates and the proposals that we vote on, just maybe not the specific part. And we only really handle the statement of work part of it, and then LDH has all the many pages of legalese that we don't contribute to. Yeah.
Just say, okay.
Want to take your activities and with the ones you from contract.
You don't have to make a motion. I mean, right now it's just discussion
Okay.
and, I mean, we could do like unofficial votes if y'all wanted to, if there was a big discussion and it was kind of back and forth. But we'll just do the one motion maybe on, when we get to the end, to just motion to send it to the council when we're finished with the draft. But right now, yeah. I don't know if it's for just preparing. I just want to let you know. But yeah, I mean, this is just committee discussion, so I don't want y'all to think that it's the informal discussion right now. I just saw it pop up there.
Karen showing.
Yes, ma'am.
I learned a lot, very good. Thank you. So, we just, I'm just thinking, yeah, you said right, we do a big picture, right? It looks like, so I try to get, idea about what we can do for this. So, so I think we'd like you to give us outline, like, I know you try to do that, right? Like just outline what we need to concern, we need to focus, like for the future of 5 year, or what we already have. We already have done some work, and what's the outcome, what's the problem. So I just try to get that clearly, the idea, so we can move on for next. So right now, just one question about like the concept of the power. They just give you the proposal, right? So you just summarize. It looks like similar as the last time we did this
They're the same concepts, they're the same one.
Yeah, they're the same one.
Yes. I just
So-
wanted to present them to y'all again, in case there were any activities. Or, you know, in case any of those, because I know at the 5-year planning committee, we talked a lot about, those concepts and what people found were important. So I just wanted to bring them up again to remind you that of those conversations and to look at them to see if there were any of those that y'all were thinking, oh, this looks like it could be a good activity that we do for 3 years or something like that.
Right, so just one question, these people, you meet that people, or they can show your presentation for what they will do, or they just provide that paper?
They just provided that paper. If we were to move forward, we put out I'm assuming we would put out a solicitation of proposals for the activity and try to get proposals, and we would send that directly also to the people that submitted the concept. So if they wanted to apply for that proposal, they could, and then those proposals go to the executive committee for them to decide who the contractor is gonna be.
Or make a
Or make
recommendation
a
to the
recommendation,
council.
yes, sorry, thank you. Thank you for the correction.
I think we talked about some topic like transportation is very fun. And I also agree that emergency preparation is also very important. Just something like a voting training, as a video, and even not voting training, other kind of training, maybe using more the video or YouTube, just that kind of better than just in personal meeting, because looks the participation, like before, we saw the summary table, the looks always, that many people really participate. Especially right now, we more online work, when people more like remoting also for us, we have a full-time job, we usually hard to join the meeting. So if you have an online kind of video on the YouTube, is much helpful. If you need anything, just search and search, then it's come up. It's much easier to access the resources, what we can get help and get knowledge and get access. So I think we may focus on the training to transfer to more to the online digital world, maybe also save one. We just made the video, and that's, I think it's a good idea. There's another thing I also agree with Constance said, we need to focus on maybe large things, because looks they keep repeat, but not so really solve some issue, right? Really solve some maybe really helps or make some change, some improvement. So yeah, that's just like I thought maybe we focus on that. It's better to get an idea and get a discussion clearly what we can do and what the funding support, and then you can help to make the management to make the real activity to come work with that. It's just myself.
So I'm gonna go through the goals on the status report and we can talk about those activities. And then that way, if you have a question about any of those activities, you can let me know. I'm gonna go through like the contractual, we'll do all the contractual stuff first, just so that way we get all of those funds out of the way, and then at the end, we'll go through those non-contractual items. I hope that makes sense, or it makes the most sense for how we're gonna do this. I'm gonna just kind of type in here if there's any activity suggestions or ideas. So the first goal on the 2026 plan, or I guess the first goal for the new 5-year plan, is people with intellectual and developmental disabilities and their families will get support and information they need to speak up, be leaders, and make the community better for people with disabilities. If we look at the status report, the first activity on here is the partners in policy making. That one actually, it falls under goal 1, and we set under objective 2. So it is right here. Sorry, let me type this real quick. And we, staff just recommended keeping the funding the same and moving it to objective 2. We found that we felt like it just fit better under objective 2 because it talks about the history of disabilities, how support systems work, how you can get the help you need, and how to be helpful and involved in your community. And then also we included a little bit of a wording change. We changed just to try to keep it more plain language and easier to read. Instead of financial, we said provide funding. For anything that has any kind of funding, if you look, they all kind of mirror each other with the wording. So for example, we tried to include provide funding, support, and technical assistance. So those 3 things are what the program monitors, what they do with the contractors. So mean, we don't provide the funding, but the council provides the funding and we support those contractors and provide technical assistance if they need it. So just kind of keeping that same language for all of the things that included funding. So that was the first one, and we did recommend moving it to objective 2 as activity. Or do y'all want to discuss that? It's up to you. If you don't like it there, we can move it. Y'all just let me know. Okay. I'll move on to the next one. The next one is activity 1.1.2, and that is on the planning status report. And so that is LaCan. And we said to move it to activity 1.1.1, so it's this one right here. And it's just because it talks about learning about your rights, connecting to policymakers. And we really felt that connecting to policymakers is what LaCan is about. But if y'all feel like it needs to be moved, please let me know. I'll move it. Like I said, these are just recommendations, but you have this say so y'all let me know. The next one is the, yes, thank you. I couldn't think of how to word that. Advocacy events. The staff recommends keeping it at its current funding and just moving it to 1.1.2. So right below just the general LaCan one. Keeping it at its current funding and just changing the wording and kind of going back to what I was mentioning earlier. If you look at that wording that was the original on the status report, it is very, very wordy. And I can just glance at that page and see the words developmental disabilities about 5 times just in that one little section. So we did recommend just changing that wording to make it a little bit easier to read and understand. But if you don't agree with it or you think something in there needs to be changed, that can also be edited. I don't want y'all to think that this is like final, we're done. But that this is final. If there's anything that you're like, ooh, I don't like that word, or I think we need to just explain this better, please let me know. I'll be typing all of that. That doorbell's loud, yeah.
About to rain.
I'll try to make this. Y'all want me to move on or did y'all have any discussion? I don't want to move too fast.
Miss Karen has.
Oh, yeah, I'm so sorry.
Oh, I just saw, looks like the 1.13, similar already to 1.12.
Yes.
What's the difference? So
1.1.3 is to fund things like the legislative roundtable, any kind of advocacy events, yellow shirt days.
LaCan training, so
Yeah.
we do trainings with the LaCan leaders. Sometimes we bring in speakers, and so that would pay for those trainings as well.
So the 1.1 focus on LaCan itself, there any activities under 1.1 for like an all-side speaker
Or like roundtables, yes, if they have an in-person roundtable or a hybrid roundtable, it'll pay for those in-person activities and trainings like that.
fun part. That's a different way to do it.
Yes. And we can show.
I mean, I'm pretty much covered. It's just anything related to advocacy expenses.
Yeah. Um, unless you all want me to slow down, I was gonna skip to 1.1.7, only because that's the next one that includes funding, and that's on page 3.
Yeah, so 1.1.4, there's,
So 1.1.4 is a little bit different because we give all of our state funds to the FHF centers. So we don't include the funding amount on here because because we submit this to the federal government. They're looking at federal dollars we spend, but FHF receives our full allotment of our state general funds.
okay.
But I
For
think-
I mean, just for myself, so, Lakin is more like at the legislative level, right? Okay, reach out to our community, well, to our leaders, so we do roundtable legislative and yellow shirt and whatnot. Which one, reach out to the community again, like, is it, that's not Family Helping Family?
Families Helping Families is like the resources for each community. They have a
Yeah,
resource.
they're the resource center
Well,
statewide, yeah, for each area of the state. And I mean, there's outreach that's done through CAN, there's also outreach that Families Helping Families does.
Okay.
There's kind of outreach components in a lot of our contracts.
So this is personal because, the reason I'm here, because I never knew, period, about, there were, anything related to disabilities at all. So my son went to school in Jefferson Parish, and, we didn't know he was having any issues, right? 5 years old, 6, 7, 8, 9, moved to the system. Never know about anything. Now, because my family, so we are capable to provide everything, okay, that he needs. I mean, counselors come to sit in the classroom, to help them, which is, I'm hearing about the paraprofessionals could have done these things, right? So my thinking was when I come here now, my son is unborn, he's 24 years old. I'm like, okay, so these services were there and I never knew. And that's why I'm here. So who was supposed, well, not supposed, but somehow, how could I, when, 15 years ago, how could I get a hand or a flyer that direct me somewhere and say, hey, if you're having difficulties and blah, 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 and call this number.
Yeah.
Right? Been to Children's Hospital, they never say, hey, call this number. We've been everywhere. As I said, we provide everything, right? And they'll tell us things like, your son having A's and B's, so he don't need no help. He's having A's and B's because of me and my wife working with him until 2 a.m. So you want him to have all F's before, he can receive services? And that's what I was told, right? And so otherwise you can't get this thing. So, and that's why I'm looking here, where could I've gotten a flyer? I think that's the question.
Yes, ma'am.
Well, the Families Helping Family Centers, they do provide outreach. That's actually part of their contract. They're supposed to go out to ABA clinics, doctor's offices, schools and stuff like that to send it out. And they actually send in a quarterly report to let me know what places they have gone to, for that quarter. So they do go out, they do provide the information. They also have webinars, other outreaches in the community just to give out the information, where they kind of tag team with McCann leaders, to give out the information. I hate that, you didn't get that information a long time ago,
That's
but
15.
I'm hoping.
Yeah, but now, I mean,
I'm hoping that now it's getting out to more places.
Yeah.
And more people are getting the information.
I have
that
my
they need.
calendar, I mean, family helping families, their calendars now is integrated with my calendar.
Good.
I have
Everything
everything,
you
but,
do, good.
but it's now,
Yeah, yeah,
because I know.
Yeah,
yeah,
well, I would add.
So I know all of their activity, all their schedules, and I even get my son, they have like, okay, adult, Zoom,
yeah.
and my son being part of it, but it's now.
Yeah.
But I'm talking about then in families like me. Well, and what about the families who don't have the means, like me and my wife did? So that's what I'm looking, how do we get to them? They are struggling. I can tell you that.
Yeah, I think some of the breakdown to just adding to what Keisha said. I mean, 15 years ago, the Families Help and Family Centers were going to all of these same places. The breakdown then becomes that provider or that organization or that doctor's office or that school then did not share with the people the information.
Accountability.
Yeah, and so that's what's hard to address, I guess. I mean, just think of the council in general. We share information like, hey, this training is coming up.
Yeah.
Well, I can't go to all households and shove it down your throat to tell you we have this training coming up. So it's like, there's an accountability component, and then at some point, there's also some purpose that our families would have to find the information. But it's unfortunate because our Families Help and Family Centers spend a lot of time and money going to these hospitals and these doctors' offices and these schools and producing this information, and then it's not getting handed out. Because I'm in the same boat with my son. He has to fail before they would provide any services. And it's like, well, the services I have provided is why he has A's and B's. I'm not gonna let him fail just to check off your boxes.
Right.
But yeah, I only heard through these things by working here. My school has never mentioned Families Helping Families. And I've actually run into a Families Helping Families staff person in the hallway of my kid's school before. But the school has never mentioned them to us, but I know they have the information. And so that's where it becomes complicated. I think our centers are keeping it up their end of the deal of getting the information out there. It's just how do you then ask these people to share that information? We've even gone and asked folks to put up like hang posters in offices, and some are receptive. Some doctors' offices, you can go and you'll see a Families Helping Families flyer up in the waiting room for folks to access. And then some won't let you put up that kind of information. So it's really difficult to get the hands into the people. I agree with what you're saying.
Yes, sir.
But then it comes to, I wanna say to y'all, then it comes out to what I'm getting out of it. And what if I do this, what I'm gonna get out of it? If I put these flyers out, what are you getting from me putting these flyers out? Is I'm gonna get this some doctor's office you can go to, and your flyer is the smallest flyer, and I mean, it's not being seen, it's not being showcased like it needs to be showcased. I mean, they could put it where they tell them put it, but when they leave, it can be showcased somewhere else. And it's sad, I run into a lot of families that just don't know, because you gotta look at it this way too. Some families are afraid to reach out for the help, to look for the help, because some of them is scared and some of them is ashamed that their kids have the disability, they have not accepted they children with the disability, and they scared to let people know what's going on. And I hope I'm making sense when I say that to you. And even though if your child, your daughter, or whoever have a disability, you can't, for people to help you, the first thing you gotta do is accept the disability, to search for some, the help. And I understand what Brenton's saying. You gotta be all the way low down to the barrel to slip through the system and say, oh, wow, I need to help them. Wait a minute. I need to do this. But some of them, it's a shame for the help. Because they always looking at, what did I do wrong? Then, how did I get in this? No, and some, it's just like that.
Okay, I'll add something too, I know Constance mentioned that the council has on several occasions talked about early childhood intervention. And so I think this kind of goes back to what Dr. Mehta is saying. Of course, you would hope that your healthcare provider would notice. And I'm just thinking about my own personal experience. Like with my children, I get developmental questionnaires. And so I fill out those developmental questionnaires every time they have an appointment. And if, you would hope that that's standard at every pediatrician's office, but maybe it's not. And so it's like, what can we do as a council, to look at early intervention training, to help to early identify some, It's just the gap in the system, Dr. Mehta, and it is unfortunate, but that's why the council is here for systems change. So that's one of our mandates, right? Is to change the system so that people who don't have the means, and they won't fall through the cracks.
Yes, ma'am.
Just try to say my experience. We actually suffering a lot about not enough knowledge, information and knowledge about how to handle my son before one. We found him that severe developmental something like autism. Yeah, I do work with a family that time. I don't have like IEP, something, and give me some information, but I just finally thinking it is still not work well, because even even the person come to with me to go to the school system to just IEP meeting, then they may say, oh, we can consider that, but in reality, it's still similar. No real change. This one thing, another thing, like my son has some behavior issue. We very struggle with how to handle that. Since for us, we haven't many support from family system. We don't have a much family member here or people available who can help. So that's make a more struggle. More, so that's why we can. I saw the actually Marie the two plan. That's how we suffer a lot, because we look like a frequently put him to emergency hospital because we don't know where to go. One has a behavior issue, one he has a really hard to care. We don't know how to do to let him come or get support. And that's also what emergency also the important, because one we suffer a lot, just so helpless, feel that. So that's why I saw that program looks good, but I know they cost too much. I just wonder because family at the center. I don't want they just provide the resource information, because right now the resource information more easy to get online, right? We do a lot of search on it. With AI help, they can support to make that more easy to get that. I just hope family can do more work to support that. That's before when I went to Indiana. That's the first time I got help, the resources, or know how to get the ABA therapy for my son. But before, I don't know. And there is a center just like a serve for disability people, and they can provide any kind of information, and they can also directly come to you for your case. So they give us the ABA therapy. That's training, help my son begin to talk, begin to learn something. But before, we just cannot do anything. So it looks waste a lot of time, like needs the early intervention. And we also hard to suffering we can't find the doctors, psychologists, just focus on special need and the dentist. All these issues just big stress for us, and so that stress come to the child, so he will feel that, and that's I think also kind of trigger behavior issue. So just hope if I just think if family have that center, that's our major center to serve for disability people. If they can do more comprehensive work on the. I just hope if they can set like this two concept report, they mentioned that idea. That's how we will reduce a lot of costs. That's how because a lot of insurance that frequently put it there, and there's an emergency. They center also consider as the emergency center, just like that kind of a concept, so they can provide more support. If they can, it would be better. I just think that.
And in an effort to do that, I mean, kind of some of the stuff you're talking about changes the, I guess, current purpose of the centers, because the centers are a resource center. Now, if you want them to get involved in any sort of like direct service provision, for them to come out to you to provide a service, to provide emergency supports, I mean, that's kind of different than what they do. That's not their role. That's just gaps in our current service delivery system that are missing for our families. And I think we would have to address it through that mechanism, because to do kind of some of what you're talking about for the centers, that's more money, that's changing the structure of how they exist and why they exist. That's, again, more money, that's more staff, that's, you're almost taking a component of letting them become a service provider to some extent to be able to do these things. And I think that's definitely outside of our scope of what we would be asking them to do.
I understand.
Yeah.
It looks like a.
But we would have to find how to address your issues.
That's why I thought it's, yeah, we just
Yeah.
consider that's maybe a goal, we can make a big change. Or just so just try to discuss or thinking about that. Yeah, I know because the resource information is more easy to us right now to get, and maybe more better to put online. Because I attend some webinar before there also, it's just that I think you still cannot get a real help support. I just hope to make they can do more real support.
Gotcha.
Right.
But my experience is that some of it is specific to Louisiana. Okay, in Florida, it was a teacher that, initiate the process. Say, hey, your son is not, I don't know, whatever, okay, in the classroom with the other children. All right. In Alabama, in Monroe State, it was a teacher that initiated the whole thing. So I thought it's gonna continue. When we come here, it's all of a sudden, oh no, your son is not flunking. Why the other two states didn't say that? So that's the experience and it was, okay, well. No, so we have to do hire private people to do it. It's always the teachers, both teachers in both states initiate the process.
Yeah.
Teachers training. I don't know, but yeah, so.
Okay. It is now 11:58 and we will take a lunch break. And preferably a nap.
I'm with you in 20 minutes.
Right,
For
How's it
for 30 minutes, right?
yes,
30 minutes to eat and then, because we're running behind.
yeah,
Minutes to eat and it's a working lunch. So that gives you enough time to eat your lunch and then we'll go back to this conversation.
all right.
If that's cool.
We're gonna stop for a lunch break and be back at 12:30.
Yes.
Right.